Welcome. Good morning, good afternoon, or good evening, depending on where you are in the world. I'm Paul Rikhardsson, the Service Development Manager of Planet Youth. Jon Sigfusson was supposed to coordinate and organize and be the moderator, but he's having technical difficulties in Iceland, so I'll try to do the best as I can. Thank you very much for being with us today. I'm very excited about this hosting a webinar. This is our first webinar. We're excited about how hosting that for you. So during the past months, we have experienced some very special times, and I know we are all concerned about the children's well-being and the effects of the coronavirus, the pandemic, what that has been having. And we at Planet Youth, we have been in contact with a lot of our collaborators in several countries, and everywhere people are working in prevention, they are inventing and finding new ways to protect the children and increase their well-being. But since none of us have lived such times before, many are asking about what others are doing in regard to primary prevention. So we, in times of COVID, so we want to propose a discussion of these two questions. So how is the COVID-19 pandemic impacting primary prevention? And how is primary prevention going to develop in a post-COVID-19 world? We had a separate webinar in Iceland earlier this week where we asked local colleagues in the municipalities about their approach and projects. We were pleased to find that there is a lot of actions and projects that have been put together and in fact, positive developments towards primary prevention in many ways. On a broad scale, we see that strong collaboration has been formed on the local level between prevention workers, child protection services, police, NGOs, schools, parents, health and social services, and the leisure activity sector and other important sectors in society. So several national initiatives have been initiated. And we hope that our initiative to share these ideas between Planet Youth partners will be beneficial. And we'll start this particular webinar with inviting our partners from English-speaking countries. And soon we'll hope to have webinars with a similar event amongst our Spanish-speaking colleagues in Europe and Latin America. We should have had 3 presenters today, Holly Morehouse, but she's having technical difficulties in connecting as well from Vermont. But with us today, we have Emmet Major from Galway. He's the community liaison worker at the Western Region Drug and Alcohol Task Force in Ireland. And Samantha Menezes from Perth, who is with the local drug action team program at the Alcohol and Drug Foundation in Australia. And thank you very much for being with us. This webinar is being recorded and will be available on the Planet Youth Facebook site and on our website. And if you have comments and questions, I hope you can send them to us through the live Q&A link, and we will forward them to the group. So I won't use more time now, but I'll give the word to Emmet to give us a briefing from Ireland and how the COVID-19 pandemic is impacting primary prevention and how primary prevention is going to develop in a post-COVID-19 world. So over to you, Emmet.
Okay, thanks for that, Paul. Thanks very much for the introduction. You can hear me okay? Just want to check that.
Yes.
Yep, great. Okay, and I'm going to share a presentation with you, short presentation with you shortly, and I'll pass it on. You can maybe put it up if you want, or you can share it out with anybody that's interested. You can have it as a PDF. So before I get started, I just want to say thanks for inviting me to come. I'm joining you from the corner of my living room in Galway, because we're largely working from home. We're currently redeployed to COVID-19 efforts in the community. So I'm actually been out doing some testing and contact tracing and all sorts of different things that can be part of my job at the moment. But we are advancing our Planet Youth project amidst all of this. And I'm the kind of coordinator for the project in our 3 sites. overall coordinator, if you like, in the 3 sites in Galway, Mayo and Roscommon. So I'm going to talk a little bit about that. For those of you who don't know anything about what we're doing in Ireland, I'm going to give you a very short piece of background, and then I'll tell you what's happening right now and what we're planning for later on in the year and how we see things developing for us here. Okay, so I'm going to do a screen share here, which will hopefully work out, and we'll be able to do a quick presentation on this. Okay, so I'll take you through this quickly. So Planet Youth in Ireland, 3 sites we have currently in Galway, Mayo and Roscommon. We're about coming up on shortly on 2 years into our Planet Youth adventure, right? So we started our first survey, first major survey in October 2018, as you can see, and we did a survey of our 15, 16-year-olds in 82 schools, and roughly pushing up and in around 5,000 people took part, so 4,800 participants, and we had about 4,400 in the sample after it was parsed. And our next survey is currently scheduled to be our second Planet Youth survey of the 3 we're currently working off, and that will be in October this year. Okay, we also actually have another site that'll be starting here in Ireland in North Dublin, and they're due to commence their first survey when we do our second one this October also. Okay, so to find out a bit more about what we're up to, that's our website. It's planetyouth.ie. It's a bit what it looks like. That's the homepage. Okay, we did our first kind of reports on the data and infographics for all of our parents, I suppose, in schools and people and communities in the region. That's a little bit what the infographics look like, and that's a cover page for one of the county reports that we developed. And most recently, there was an interesting piece of work done and launched in February of this year, which was this document here. That's the cover page, the strategy and implementation framework that we put together. So that anybody can understand what we're up to. Anybody can pick up that document and get to grips with what Planet Youth is, what it's all about, where we're going with it, how they can get involved. And that would be anybody from, I suppose, a parent in the community, to a youth leader, to a coach, to an agency, to a prime minister, if you like. So this explains what Planet Youth is all about for us here in Ireland, what it looks like, and how you can get involved and what the next steps are going to be. Right, so it's an interesting document that's available on the website if you want to have a look at it. It's there as a download as well. Okay, so that document was launched by the President of Ireland. Actually, he helped us with the launch back in very early February 2020, before all this COVID-19 kicked off. And the vision statement in the document is that one there. Okay, so all young people are active, healthy, happy, connected to their families and communities, and achieving their full potential. Right, which is, I think you'll admit, a lovely vision. And that's my understanding really of what Planet Youth is all about. Right? That's what we want to get to, and we're going to use the Planet Youth mechanism to get to that. Okay, so let's move it along a bit. Okay, our current activity, right? So we were actually up in Iceland as a delegation. We had some people up from Ireland in Iceland in early March, just as the COVID-19 was coming over the horizon. There were concerns even in early March, but we're in a very, very different landscape by the end of March. Events overtook us very quickly. Schools are out since the end of March, and we're currently in our 8th or 9th week of what's this very significant lockdown. So parents and children have been at home. They've been a lot of schoolwork has been coming from home. Our major state examination, which will be the Leaving Cert, which kids take at 18 or 19, has been cancelled this year. So there'll all be some kind of predictive grading done. So things are still somewhat chaotic and unknown, right? But we have been doing a lot. Planet Youth has been doing a lot while this has all been happening. And part of that, throughout April, we put on a series of these nights, right? There was about 5 of them actually in total, which were very successful. Parents responded hugely well to all this uncertainty. We put on these parenting your teenager during COVID-19 online workshops. We had 50 or 60 parents at all of these events. And we had them facilitated where parents were along in facilitated breakout rooms using Zoom breakout. And we were having discussions around what's challenging for them, what's been good about this whole thing, because there's been good things and bad things in it all, challenges and opportunities. And the parents found it hugely supportive and thoroughly enjoyed it. So this is a useful piece of work, and we were keeping the whole Planet Youth project moving along with this, because it got a lot of coverage in the media and press and social media, and there's a lot of interest in it, and other pieces and people around the country are trying to do similar stuff. because it was unique in its way of engaging in a very kind of facilitated way with the parents. Very little of that actually happening. We did a little bit more with it as well, followed up. So these were actually, one of these was just Tuesday this week and one was last week, which were more webinar focused. So these are kind of things that parents can dial into and look at and kind of submit questions on Facebook Live, that kind of thing. So we did this motivation and your teenager thing, because that's what we're finding. A lot of young people at home are struggling now, that particularly the schools are coming to an end for the summer anyway. The exams are gone. So why would they, keep up with the study? So there's bits and pieces that we were discussing around that with the parents. So that was, there's, I think it was about 1,400 people viewed that webinar by the next morning. So that was very successful as well. We've been working on developing the Planet Youth Ireland kind of social media channels during all of this. So there's a new Facebook and a YouTube channel and a Twitter account. So they've been very active. And there's an ongoing piece now that'll be happening starting actually early next week, so Tuesday, Thursday, following week, which will be these more focusing on what we call pre-adolescent. So this is kids, what we have here in Ireland in 6th class. And we're doing a very similar piece of work where we're engaging all of the parents around what struggle right now for these young people and for them as parents, because they're coming to the end of their national schooling. Their primary school is coming to an end, and yet there's been no ending for them because they're in limbo, right? They're going to have to go and attend into secondary next year, not having had their graduation, their confirmation, all the usual stuff. So very hard for them. But this gives a huge opportunity to Planet Youth as a project to support these parents and explain to the community at large what this whole thing is all about. So I'm going to come back to that a tiny bit in a minute, right? This was a hugely successful piece of work that was done last September, October for all of our first year parents. So that's the way the school cycle works here. The kids start school in September and it runs through to May, June the following year. But every year we have a new batch of first years, which are 12 and 13-year-olds coming into school. And these particular resources were developed based on the Planet Youth survey in October 2018, right? And was hugely well received. There was very stuff, and we could see the kids weren't getting enough sleep. There weren't too much screen time. There was this happening, there was that happening. So a very, very simple guidelines booklet and giving parents information and ideas about what bedtime should be, what screen time limits should be, what alcohol parameters kids should have, this kind of stuff, right? And explain to them that if they work together a little bit harder, we can achieve a lot as parents and as communities in terms of the health and well-being of these kids. Right? Very simple steps, but actually quite powerful. So that was a hugely successful piece of work, and we're currently working on next steps of the project. And one will be something very, very similar for those 6th class parents to assist the young people in the transition now into secondary school. So we're taking some of the work that was done in Iceland around kind of parental contracts, parental networks, that kind of thing. And that's a big piece of work that we're going to be advancing here in Ireland over the summer. Well, imminently, really. We're starting very soon. And the COVID-19 has kind of just hurried that along, I suppose, a little bit, right? So there's been opportunity in it, right? In how we've gone out and very rapidly been able to respond to parents because they were a little bit left in limbo with the way things have developed here. Okay, so that's one piece that'll be happening. We're planning towards October 2020. As you can see on here, we have a survey schedule currently for those middle 2 weeks in October. Our 3 sites, Dublin also, right? But the plan at the moment is to go ahead with that. It's a little unknown because we don't know quite how and what format the schools are going to go back in September. They may be delayed, there may be reduced numbers. It's completely unknown, right? But at the moment, we're working towards that. So we'll be doing some work with the likes of Inga and Jan in Reykjavik around the development of our next survey for youth here in Ireland. We're already having those discussions, but what we want to do is this inclusion of a range of the COVID-19 questions. I know they've already been thinking about that in ICSRA, but there's a hugely important opportunity to study the impact of COVID-19 on these young people, because it will be significant, no doubt, right? Other pieces that have to be advanced is our ethical approval and consent for this kind of thing here in Ireland. We have to do a translation into Irish for some of our Irish language schools. We have to do the printing, the distribution, and also then look at this time around. Last one was all paper-based, but this time I think we may need to look at doing some of it online, depending on what format the schools go back. So there's a lot going on, a lot happening. Our trend, as you can see at the bottom, I think that would be one thing that will come out of this, is that our first survey was October 18. Our next one is this October. So our trend, and such as we have one, will be somewhat disrupted. You know, the things that the survey was showing us that we were hoping to see a direct correlation, if you like, from the previous data, it's going to be offset because, you know, these kids aren't in hobbies. They're not out playing sports. They're not intermingling. You know, they're not having their usual routine. But the COVID-19 piece of the next survey will help. Will help in a kind of an analysis of that. So that's more or less what I wanted to say. Right? There's a huge amount going on. Actually, we've been extremely busy, and we've managed to move the project along, the Planet Youth project here in Ireland, along fairly significantly in the last 2 months because of COVID-19. Right? How is primary prevention going to develop in a post-COVID-19 world? I can't say yet. I'm just looking at the question that's been phrased there. You know, is one of the things to talk about. Is there a post-COVID-19 world? That's another thing. Really, is, you know, we don't know what the future is going to be. We just might have a COVID-19 world rather than a post-COVID-19 world. So that's all to be decided and determined. But I would say there's a huge opportunity within all of this for primary prevention and for Planet Youth. And all our partner agencies in the region are fully on board, enthusiastic about the project. It may put us slightly on the back foot because we don't know quite what's coming. I think there probably will be some small issues around funding because we had been looking for very significant funding to do interesting bits and pieces with this project around, you know, funding of hobbies and sports and development in that area. Now, there may be some challenges around that because we're obviously unquestionably heading into a tight funding stream now. You know, we're heading for a recession. Nobody knows how bad it's going to be. So that will get harder. But within that, there's the opportunity as communities and as parents and as schools to respond with what we've got, right? And I think that's what we'll be trying to do. So, yeah, taken as a whole, I'm still highly optimistic about where we're at. I think we can advance the whole thing very significantly, but it will be within the confines of, you know, where the whole thing is going. We can only do so much, and we're still seeing how the landscapes develops here in Ireland. We've a long way to go before we're out of the woods with this, that's for sure. So that's it from my point of view, Pal. Thanks for that. And if there's any questions, I'll try and field them as we go along later, okay?
Ian, thanks very much, Emmet. But I detect a note of optimism in your presentation that we actually have opportunities on the back end of COVID and going forward.
Oh yeah, absolutely. Yeah, very much so.
Brilliant. Thanks for that.
Thanks,
Emmet, very interesting to hear about the experiences in Ireland, and also that optimistic note about how the impact of COVID, we haven't seen the last of it yet with the economic recession that is definitely on the way, but I think it's good to note the optimism. We'll get back to that later in the Q&A after the presentation. So I want to give the word onwards to Samantha, who is joining us from Perth in Australia. So it is almost time to go to bed, Samantha, isn't it?
Oh, it's about 7:20 p.m. in Perth in Western Australia at the moment. So you can see me and everything. I've never done a meeting on this platform before, so it's actually working well. Thanks for having us. I mean, this is a very exciting opportunity for us to obviously share internationally some of the things that are happening in Australia, and it's really great to see Emmet and hear your really positive response to what I understand in Ireland is quite a, you know, scary situation over there. My son lives in the UK, so same thing. Australia's not been. Look, we have been affected somewhat, especially economically with all of our shutdowns, but in different states of Australia, there's different shutdowns and openings happening at the moment. So it's a little bit confusing, but, and we do have 5 Planet Youth sites here in 2 different states. So they're obviously sort of facing their own 2 challenges there around the different sort of things that are happening around these closings and openings of schools and so on. So I'll just share my presentation now. Okay. So I'm hoping you can see my slides okay. It's looking okay. So essentially, yeah, the 2 questions were interesting. I thought that I had to think a lot about the second one, actually. So I think a bit like Emmet was saying, it's a little bit unknown. But what I wanted to start with was some discussion around the organisation that I actually work for and who we are and how come we ended up being involved with the Planet Youth model in Australia. So essentially, the Alcohol and Drug Foundation, we originally dated back to the post-war years, and we had an Australian war hero called Sir Edward Weary Dunlop. Our returned servicemen from war were struggling to cope with the trauma, and they were turning to alcohol to ease their pain. Dunlop and a group of his concerned citizens called for a community approach to address the increased alcohol use, and they wanted to involve education, treatment and research. And so that's how we began. But the modern day ADF has since evolved as a national organisation that is funded by state and federal governments. Our work is independent, non-judgmental, and highly professional and evidence-based. And while World War II is now part of our history, the issues around drinking and drug use have never been more relevant, and we will hear that obviously throughout this presentation. And, you know, I mean, COVID is almost another war in itself, so we're dealing with another pretty a major event in our history of the globe. Essentially, we are the largest organisation in Australia working in this area, and we stand at the very centre of national efforts to prevent and minimise the harms that can be caused by alcohol and other drugs. We're not an abstinence-based organisation. Instead, our focus is on preventing and minimising alcohol and other drug-related harms in the community by addressing risk and protective factors. So generally we work in community-based programs. I mean, the support of local communities can go a long way in helping to prevent and minimise harm from alcohol and other drugs. And at the heart of everything we do is a community-centric approach. We recognise the power of strong communities and the important role they play in preventing problems occurring in the first place. We work hand in hand with our local drug action teams, supporting them to develop and implement programs tailored to their specific needs. Tackling their specific concerns in their local area, and we understand that a one-size-fits-all approach doesn't work. Just to give you a bit of an idea, one of our major programs is the Local Drug Action Team program. It's basically why Planet Youth ended up coming into our work, because we could just see the synergies were just so aligned around how the Planet Youth data and the model could be helping our community teams on the ground tackle these issues around you know, the risk and protective factors for their young people. So that's how come, you know, part of the reason why we started with Planet Youth was to actually help inform our work and our evidence around why we do these things. We've got around 244 local drug action teams. They're working on various smart and effective campaigns across Australia, and 5 of these are actually our Planet Youth pilot sites. So we have 3 sites in New South Wales and we have 2 in South Australia. So essentially our program enables a small group of local organisations to connect into a unified team to work on a specific project or activity. And these teams include, you know, can include schools, health workers, police, community organisations, councils and businesses, and, you know, like many of us in this room obviously are into this type of work, and it's just amazing to be involved with so many passionate people. I mean, the idea of a local drug action team is that they identify local issues, and to do that they need data. So the Planet Youth data is perfect in terms of if the groups are wanting to work with youth and parents and that sort of local environment around local governments and all the other important stakeholders. So just getting on to how, I guess, the COVID, the first question is, how is COVID-19 pandemic impacting our primary prevention work in Australia? So essentially it is. It's been super challenging. Our organisation, I don't think, has been any busier than what it is at the moment. It is absolutely flat out, and the whole entire organisation is working from home. So we are, you know, juggling our own sort of struggles around managing our family and our kids and our schools, as well as supporting our communities. So what we thought we would do is we would send out a survey to all of our local drug action teams, because we wanted to understand how COVID-19 was impacting our primary prevention through our programs, including our 5 Planet Youth sites. So it was a really, really interesting survey. So more than 3/4 of our respondents, 78%, said they were concerned or very concerned about the growing alcohol and drug-related problems in their local communities. The key challenge for them right now is responding to the many COVID issues in their communities, such as escalating mental health problems, the closure of buildings, and increasing the use of alcohol and other drugs. Around half of the survey respondents said they needed practical advice to share with their communities, including best practice examples of online information to reduce alcohol and drug-related harms. Most of our survey respondents felt that the Drug Action Team program will be important or very important in helping to prevent AOD harms post-COVID. And after restrictions are lifted, the top challenges will continue to be the community's increased mental health problems, increased alcohol use at home, and increased drug use. More than half of our teams thought that a lot of time will need to be spent in adapting their work to the changed environment. So this includes, the responses from our Planet Youth sites. And to sort of give you a bit of an idea of where they're at, we actually only surveyed our sites back in December 2019. And the workshops we had to share the community findings were fantastic, and they were held in only February this year. So they're at the stage of just disseminating their findings, and to do this amidst COVID has been extremely challenging because obviously the schools are at home. There's no sport, there's no socialisation, and they're having to think about really creative ways to get the findings out to the key community members, just to keep the action going and to keep community interest in the Planet Youth work. So we've been working really, really closely with them, but because of our organisation's support, we've been able to really reach out quite widely to not only our Planet Youth sites, but all of our drug action teams, and develop some resources to just help them be able to share to their networks, just to enable that community connection, increase in awareness to support services, and just increased awareness around alcohol and drug use, particularly alcohol use in the home while parents aren't working as well. So here's just a couple of sort of pictures, I guess, of some of our website links that people can go into, and there's loads of information embedded in each one of these. And this has come as a response to the feedback that we had in our survey. So we've got information kits on how to leverage social media to stay connected. And we've got some creative assets to use when responding to the COVID issues in the community. We've also developed just down, I don't know if you can see the bottom picture on the right, is a coronavirus hub. So people can click into there and they can see articles about how mass trauma affects alcohol use. They can read about alcohol use in the family, isolation and relapse if people do have some alcohol and other drug issues, the importance of awareness of mixing alcohol with other drugs, and also really importantly, links to federal and state-based coronavirus information, which has been really useful, particularly for our Planet Youth sites, where each state may have their differences in how they're opening things up, and I guess how they can manage their work through their schools and other community organisations. We're also developing other additional resources which we're going to be sharing with our communities over the coming weeks. I thought I'd take some opportunity to share with you some success stories in the local drug action team program, because some of our teams are quite advanced and have been in the program for a while, but this just shows you what our Planet Youth sites are exposed to, I guess, through the program, and they get to share some of these stories and actually use some of these stories and develop their own actions based around the exciting things other people are doing across Australia. So one of them is connecting youth through virtual art classes in Nannup. And Nannup is a community quite close to where I live, actually. It is in the regional area. It's tiny. It's full of really, really passionate people and amazingly connected community, always trying to sort of keep the kids busy and occupied, just because they are so far away and they don't have the access to the services that our cities do. So what they thought they would do, they were developing a face-to-face youth zone. So it's had to actually close its doors for the time being, but they still wanted to make sure that young people could access social and recreational activities online. So they adapted one of the things that they were doing to a weekly online art workshop and it's led by a local artist named Leanne. So a quote from Leanne was that, we realise that this is an opportunity to engage young people, but in a different way. At first they were a bit concerned, but it's been really uplifting, and people in the community are really supportive of the idea. You can see the little kiddies there, but they've got a range of things happening across different age groups. So it's not just young children, there's a range of things for teenagers and so on moving through this. So they're basically looking at how they can extend their online workshops to include other activities like at-home skateboarding workshops, and they've created a beautiful art bubble, but would like to do more with programs so they can connect with more people. So they're looking at, using ways of using social media to push out more messages around mental health, importance of spending time together and staying connected. So that's just a bit of an example about one of our teams. And in terms of Planet Youth, actually today we're just developing a story about one of our Planet Youth sites in the Blue Mountains who have been sharing their findings remotely and have really commence planning activities that they can do regardless of the COVID situation. And we'll definitely be happy to circulate that through when that's completed, that story. But this particular group of people hadn't used a lot of Zoom or sort of online meetings before, because they are in a fairly small community and that they can connect up fairly well face to face. But it's really done some amazing things for this community, and also for the other sort of 4 sites. Have all expressed that the opportunity to go online has been quite exciting. This particular meeting, when they were sharing their findings, sort of talking about the second phase after the workshop, I guess, actually had the 2 schools who didn't participate in the survey come into the meeting, which was really exciting for them, because those 2 schools have been able to hear about the community findings and, see the benefit of participating in the survey. And they've also established 3 subcommittees who have a plan. They've each got a plan that's going to target parents, schools and after school activities in this COVID environment, and then planning moving forward from there. So, all of our sites are finding creative ways to share their findings. We're not quite at the stage with them that Emmet is around, sort of developing activities. Some of them are along the way, but their major priority at the moment is just discussing, the findings. So, and from that, they'll be developing some community action plans just to ensure their activity on the ground addresses those risk and protective factors identified in their surveys. So then I was going to move into that big question: how is it going to develop in a post-COVID world? Well, this is the ever big question, because what is that going to look like? As Emmet was saying, we did ask a question in our survey about this. We asked, what do you think your greatest challenges will be after the restrictions are lifted? And I think these challenges would be pretty well global. Increased mental health problems, increased alcohol use, the time needed to adapt to the changes post-COVID as well. They're worried about increased drug use and resuming face-to-face delivery of activities. So, more than half of our LDATs thought that that a lot of time will be needed to spend on sort of adapting their work to the change environment. So, I guess that probably involves funding and just trying to keep the momentum going in that prevention space when they possibly have been pulled a bit out of that. I mean, some of our councils, for example, have been going around taping up playgrounds and taking out water fountains so people can't share water, and all sorts of things that they do unfortunately get caught up with these things that happen. Some of our Planet Youth sites have conveyed pretty similar messages actually, and it's very, very positive. There's a lot of media in Australia at the moment around alcohol particularly. We've got lots and lots of commentary around the advertising of it. I mean, it's gone crazy. We've had to put restrictions in place on buying takeaway alcohol in different states, particularly at the start of all the COVID in Australia when people were hoarding alcohol. So the opportunity to share information is massive at the moment, and that's what a lot of our sites are looking at doing, or are doing actually. So in general, I would say they're pretty excited about post-COVID because the opportunity to innovate has become very attractive. The 5 sites are enjoying online program delivery, workshops, catching up with people, all those sorts of things to share their findings. They've said that they're finding more people are coming to the meetings due to the convenience, I guess. Maybe because they're all working from home and you know, a meeting pops up that looks pretty attractive, so they jump in. The challenges of you know, of course, relate to the delivery of activities and staying connected once all of this is over and done with. And I think it's really important that we're sharing these stories globally. Some of the things that they're pretty excited about are, obviously, as I mentioned, online program delivery, creative ways this can be done through high-tech application, digital tools and platforms. So just having the chance to explore that for some of these LDATs and pilots, Planet Youth sites has been nice, because they don't often get the time to explore these kind of creative ideas. Online community action, so stakeholder meetings, partner meetings, sharing of the findings. Opportunities for collaboration across sectors, so alcohol and other drugs, mental health, for example. Local government opportunities for prevention, alignment of prevention campaigns nationally. Look at what's working and to reduce the information overload as well, because there is a lot of information coming out and some of it's not true. So just sort of being able to share evidence-informed information is really important. Looking at the way global information sharing is happening and data-driven decision making, online school and work options, updating or creating new websites to be more responsive to community needs, linking to support services, webinars, online programs and mental health support is really important for our Planet Youth sites. There's an increased focus on the social and political determinants of health and social support for at-risk groups of people in our communities, and how can we ensure they are receiving the support in this really challenging environment. There's opportunities for advocacy. There goes my phone for some reason. Opportunities for advocacy, increased alcohol sales, for example. That's been a huge opportunity for advocacy in Australia. And there's, you know, possibly we're hoping more opportunities for funding primary prevention based on the importance of public health and how it's just suddenly the hand washing through to how do you keep people, you know, happy mentally. And opportunities for legislation changes. For example, in WA, there's some discussion about local government allowing restaurants to allow people to dine outside, to allow social distancing, which means possibly changes in liquor licensing conditions and local council laws. So there's a stack of opportunities. I think that's pretty much finished my sort of conversation today. It was around, I mean, we are very early stages in Planet Youth. The data is definitely informing some of our activities in a much more structured way around young people and parents and on the wider environment for them. So I thought the opportunity to talk about local drug action teams in general, just to show you what our organisation is doing across Australia and how Planet Youth fits into that, was probably a good opportunity to talk about COVID and post-COVID, and the importance, I think, of organisations having primary prevention at the core of their work. So it's pretty exciting times working at the ADF at the moment. And just wanted to say thanks for having us.
I was just saying we'll spend the final few minutes answering some questions that have been taken in throughout the webinar. And one of the questions is about alcohol consumption. If alcohol consumption is actually increasing as pubs and bars and discotheques have been closed during the COVID epidemic. So is the consumption actually increasing, given that the sales outlets have been the number of sales outlets have been reduced? How is that in Ireland?
We don't have any data, Paul, to offer you other than anecdotal. And yeah, we've had a lot of calls coming in from the likes of, let's say, GP practices and nurse support and different things, saying, how do our people, you know, how do our patients access services? And so we can see that there are concerns, you know, and let's say, for example, the typical supports that might be out there for people like one-to-one counselling or outpatient support, things like Alcoholics Anonymous and other recovery meetings like Smart Recovery and things like that, everything's shifted to online and is at a reduced capacity. So there's very little support out there for people. We know that people, when they drink at home, they tend to drink more anyway. They can tend to over pour and things like wines and spirits and things like that. So they tend to drink outside the lowest guidelines. So Impossible to say. In terms of the general population, we'd say, yeah, there's certainly some concerns. We can't measure it yet. The data won't be in. In terms of the young people, the younger people starting early onset drinking, that kind of thing, I don't know. That might be down a bit. But again, we won't know till we measure. You know, that's just, I don't know why I'm saying that. It's kind of an instinctively saying that because they're at home with their parents a lot more and there's less opportunity for being out and about with their friends and that kind of thing. But when we get to survey them again later in the year, we'll be able to measure that a bit at that stage, I think.
Right. That's interesting. So how is the situation in Australia? Is consumption of alcohol has actually gone up, Sam?
Oh, yes, it definitely has. Yeah, it's there is definitely some statistics. I mean, one article I'm reading now is saying 70% of our Aussies have turned to the bottle during lockdown, for example. There's some work through another organisation called FAIR, Foundation for Alcohol Research and Education, and they've recently, they're the ones that are talking about the alcohol advertising in that screenshot I showed before, about how many times a minute alcohol is being advertised currently in Australia. So the alcohol industry has had great time in using COVID to their benefit. So that's part of the reason why in different areas of Australia we've had to have restrictions put on in serving of alcohol from, I suppose, what you would call liquor shops and liquor barns, because some of them are so massive, they are the size of a barn. We've had to stop people buying certain amounts because they were just hoarding it. It's unbelievable. So, yeah, there's a lot of concerns in Australia about that at the moment.
Right. Interesting. Another question. Sorry, Emmet.
No, I was just saying it's good to hear. You know, it's very interesting. We don't have quite the same setup here, insofar as we don't have any pubs or bars or restaurants. Everything is closed, but then market outlets are obviously open, and I'm not even sure about our off licenses. So let's say, for example, we might have shops that are just dedicated to selling alcohol, like off licenses. I think I'm not sure if they've been open. I haven't been out enough to see, and I don't really see them that much. Observe them, as it were. But certainly, supermarkets are open and still selling booze, and they're still being advertised in the paper and what have you. But I haven't seen that the ramping up that you're talking about, Sam.
We've even had.
Sorry, go on.
Home delivery has increased, and in some places they've allowed alcohol to be delivered with food. So, you can have takeaway food. So some licensing changes to allow alcohol to come along with your food. So, and there is concerns around ID checking with alcohol deliveries in young people. That's not something new. That's been something in Australia for some time now. And, it's becoming more apparent that the legislation around checking for ID is not always adhered to when you're talking about a courier who's dropping off alcohol to a house. Yeah. So it's pretty concerning.
Yeah, we would have that here also, where we would have the same kind of thing been talked about here for a good while, where we Deliveroos and things like that, where people are getting stuff, and there isn't that. Those checks and balances aren't there whatsoever.
So another thing a question that popped up on the live feed is that one of the tenets of the Icelandic prevention model in Planet Youth and prevention work is the family, and family support is one of the preventive factors that we work with. So just wondering, in these COVID times when kids have to spend a lot more time at home, a lot more time with the family, so what about those kids that do not have that parental support? That have dysfunctional families, that have families that are not a preventive factor as such. Do you have initiated any initiatives, or how are you tackling that particular problem?
Do you want to field that, Sam, or do you want to jump in?
Yeah, look, I mean, that's the biggest problem, isn't it? Is that it's difficult to reach the at-risk families as it is. And I think with COVID, it's even worse because it's all hidden so much more inside now. So, I mean, I guess we don't have actually any particular strategies that come to mind aside from trying to get our communities to work together to increase connectedness. So giving young people opportunities to come online into different exercise groups or keeping those. I mean, another part of our work is working with sporting clubs. We have a program called Good Sports. It's been running for over 20 years in Australia, where we work with the committees of sporting clubs to implement alcohol-related and other drug-related policies and procedures that then become part of the club culture. So they get embedded down into the members, and a lot to do with like promotion of the healthy messages in families. So these sporting clubs, we also surveyed them. So I didn't talk about that, but we surveyed the sporting clubs, and we're looking at what do they need from an organisation like the Alcohol and Drug Foundation to support their work. So, but a lot of them have just been so amazingly independently able to connect with their communities through offering online stuff to do, so fun things and creative stuff. So we're just hoping that, you know, the young people can access this varied amount of stuff that they can see through all their social media channels and online, and they do find some support in connecting with their community if their family's not supporting them as they should be. It's a pretty hard question to answer, actually, and there's no miracle solution, unfortunately. What do you think, Emmet?
Well, I'd echo a lot of what you said. To be honest, we would have the same issues here, really, where the families typically, and we've done an awful lot of work with kind of engaging with parents via schools and kind of reach out to people that way. And everybody will always say the same. It's always the parents that you need to reach most that are the hardest to get in front of, to get to talk to. So, you know, we haven't said that we are doing stuff in that line. We have a child and family agency are always there and reaching out to that particular at-risk group of people. And COVID-19 is going to throw that up into a bit of relief. There's no question about that, because there was a lot of concerns about, you know, the close proximity of people being in together in close confines and things, that we might see a huge upswing in domestic violence and different things like that, which hasn't been borne out just yet, thankfully. We haven't seen it coming through in terms of our refuges and things like that, but that still remains to be seen. We're only we haven't finished here yet, you know, so this is still an ongoing issue. But yeah, there are things happening. We are doing kind of specific programs that will be reaching out to more at-risk groups. But it's, you know, as Sam was saying, it's a constant challenge. You know, sometimes the people that are hardest to reach are going to remain that way, even when it comes to things like the technology, because we're doing a huge amount of stuff online. But we were trying to reach households where, you know, there might be one device that everybody shares. They mightn't have a laptop. They might have a phone. They might have credit. All of that kind of stuff is a challenge, you know. But, yeah,
I agree. I think we also have an information sort of service where at the ADF where people can call through to seek support. So we actually refer them off to support services through that information line, which is really, really useful. I don't know. It's probably a good question to ask if those calls have increased to that service. I could find that out and let you know. But we do offer that through the Alcohol and Drug Foundation. But the other thing is that local teams can do on the ground is you know how, Emmet, you were talking about the access to the internet. We've had the same thing. So we've had our teams raise that with us. How can we help our communities access more data so that children can, you know, have enough data to do their schoolwork, let alone activities online. And so, you know, that's really hard because that's all to do with funding and availability of funding. So, you know, we encourage them to reach out into their wider community to see how could they collaborate to enable that to happen in the homes of these children. So, you know, reach out to the schools and say, look, you know, we've been approached by a certain amount of families from your sort of school area, like that are having problems. What can you sort of do to help? So I think it's just about supporting the teams on the ground to be able to have that confidence to reach out and see if they can try and do something to mediate these issues.
Tricky, very tricky. Like a final question would also be, so how do you see, you know, being at home, you know, there's a lack of structure being at home, and there's a lot of, at least I can see it in my kids, there's a lot of focus on the virtual environment. So they are in touch, and we all had a crash course in online meetings, webinars not so much apparently, but we all had a crash course on how to function and keep things going, like online and virtually. So do you think that development in almost all over the world, with teenagers also interacting virtually and online and different social media, will that have an effect? Will that have an effect on primary prevention going forward after COVID?
Well, I'd say it's an interesting one for study. There's no question of that. But something that we're going to be building into the next round of the Planet Youth survey we do in Ireland, hopefully. Mm-hmm. We have a sociologist attached to one of our committees who works at one of our third level institutions here, and we know there's been some discussion around what sort of format do we want some of these questions to take, and that will be one of the areas that probably is worthy of examination, is from a technological point of view, what sort of impact is this having? Because the kids, they've been hammered by the parents not to be on screens all the time, and yet they're getting stuff coming out from schools where they have to be on screen. So it's all come very blurry, and yet it seems, okay, young people, they like to engage, or the kind of social media, the Snapchat, the Instagram, all that kind of stuff. But if you said, why do even my own youngster here, if I say, well, why don't you get together on a Zoom call with your friends, and do something? No interest in that, so there's a lot of interesting stuff to be looked at there, and I think there might be an opportunity to do it, as we go forward with the next survey. Yeah, there's definitely something in that, amongst the many questions we could be asking them about how COVID-19 has impacted them. That would be one.
What about Australia, Sam?
Theories, probably. Yeah. Sorry.
Well, I think we have the same challenges. I mean, I think parents are concerned about the amount of time kids are having to spend online, because they are at home and they do have to do schoolwork, as well as then they do their online socializing because they can't see each other, and that could go on for hours. And then it's the parenting dilemma, isn't it? Like, you try and get them off. I mean, I know with our house where we have 4 children, one lives in the UK, but trying to connect them with games and sort of hang out together and even watch TV together or whatever, that's like pulling a flea off some Velcro or something. It's just like, oh, must we? So I'm sure the challenges are there, and I'd be very interested in researching that as well, because in one way it's great they can be so connected with their friends, because imagine if we didn't have the internet. And I mean, this has happened globally before, hasn't it? How did people survive socially when the kids are very lucky these days that they have that, but it has the other side of it, which is concerning, I think.
Yeah.
Worthy of investigation, no, sir.
Definitely, absolutely.
And I would say, just to touch on that, I mean, the present situation, COVID-19, awful and all as it is, there is that piece where it's something of an opportunity for Planet Youth, at least here in Ireland, because when we come back and the schools come back in whatever form that might be in September, October, we'll be in a really good position to do something very interesting with the survey that nobody else is doing. Nobody else has the same sort of access to the schools here that we have, that can do the same kind of comprehensive look at exactly what's going on in that cohort of young people, because nobody else has it scheduled at the moment, and everybody's going to be busy with other stuff. So. I think people will probably sit up and take a lot of notice of what's been said in the next round of the survey, assuming we can get to do it, and quite how that's going to look. The summer will tell us that.
Yeah, absolutely. We are in Planet Youth. We're also developing a battery of questions to include in the next surveys in the different countries that we are operating in, also to be able to compare them between different countries as well. So I think there's definitely a big opportunity for gathering knowledge about the effects of a worldwide event, a black swan event, if you like, and the COVID pandemic on how the well-being of the kids develops, and the consumption patterns of drunk and alcohol as well.
Yeah, absolutely. Definitely.
Right, guys. We're approaching, at least in this part of the world, in Denmark, 2 o'clock. So I would just like to say thank you for joining us from Perth and from Dublin. You're based in Dublin?
No, the other side, Galway now.
Galway, that's right, Galway.
The nice part.
Thanks a lot for your time and effort, and thanks for joining us. Really, really interesting presentation. I hope our attendees have got some insights on what is happening. Like I said, this was our first webinar. We had technical difficulties. We managed to get it on the air regardless. But I think we'll repeat this. We'll do this again just to get people to share experiences, to share initiatives and innovations in primary prevention around the world, and not necessarily post-COVID, but just what the Planet Youth partners are doing. So thank you very much for presenting, Sam and Emmet, and thank you all of you for attending. We will make this, we might edit this video a little bit and put it on Facebook afterwards, where you can, the Planet Youth Facebook page, where you can access it afterwards. So thank you very much, and stay safe.
Thanks, Paul. Thanks, Sam.
Thank you.
And thanks, everyone.
Thanks.